This is my presentation over the ICF model. This model is a sort of framework for organizing and documenting one's functioning and the disability. It allows for a broader context for providing the best evidence-based care to patients. It also allows one to use quantitative measures to provide an assessment of where the patient is currently, such as starting points for setting goals throughout the rehabilitation and measuring improvements throughout their treatment to see if they're progressing, if so, by how much, or if they're not, by how much are they not, and how worse are they getting. This just allows for it to be easier when adjusting the rehabilitation plan. And this is also what they use to measure the quantitative measures for an assessment. You would use this from no problem, mild, moderate, severe, complete, not specified, or not applicable. And again, this assesses the patient's functions. And the framework is the at the top you'd have health condition, then in the middle activity limitations such as speaking, walking, jumping, and then participation restriction, you would have work, social, athletic, and then body functions and structures such as impairments, which would be with your bones, ligaments, muscles, sensation, circulation. And then environmental factors, your living conditions, occupational situation, social circumstances. And then personal factors would be like age, personality, and whatnot. And then my example is a sprained ankle, and your activity limitation theirs is going to be not able to bend, carry, lift, stand, run. They're a D1 college athlete who also works, and their work requires them to lift and transport things. So not being able to bend, carry, lift, stand, run, this really is very detrimental to their everyday living, and it really requires an adjustment for them. And participation restrictions, unable to compete in their sport, they're unable to work because at work they're still supposed to be on their feet all day long carrying things, and just because they take a break from competing in their sport, but if they're still at work, it's still going to be detrimental to the rehab process. And then body functions and structures, impairments, joint injury, soft tissue injury, environmental factors. They need to be able to compete because that helps pay for their, as a scholarship helps pay for their school. They need to be able to lift and carry items at work, which they're also unable to do so. And they're a college athlete, so they need to be able to run like I previously stated. Personal factors would be a female, 20 years old college athlete. Thank you.